My name's Maddie. I'm one of the clinical pharmacy specialists. I work in the ED and ICU. I think I know most of you guys. And
I'm Molly Droege. I'm the other Droege. Sorry for the confusion. I think I had Chris listed as presenting, but it's actually me. I do surgery, orthopedics, and trauma, so I know more of kind of the SICU faces over the medical side of the faces in the room. So nice to meet everybody who I don't know. We're doing pharmacy Jeopardy for you guys today. So we want to split you guys up into 2 teams, maybe right there.
Yeah. I don't know.
Yeah.
Maybe, I don't know.
Maybe 1 or 2 extra. Yeah, we need a couple more positions on this side.
Over here.
Yeah. Maybe we'll take this whole, all 3 of you
maybe
guys.
This whole
all 3 of you guys come over there. Because all of them are kind of clustered up there.
Yeah.
You guys get Erica, but this team over here, they've got the 2. Yep, we've got pharmacy students back there. Natasha, if you want to come up here. So you guys have got, you've got Erica and some students. They've got 2 pharmacists and 1 student. So, all right, I see. All right, so you guys want to come up with your team names because we're going to alternate. Yeah, we want team names. Team names, yeah. What's your team name? Team 1, team 2, or do you want different names?
You want to be creative about it?
We're keeping score.
Everyone wants to be a surgeon. No, we'll be the Narcans.
The Narcans? Okay, what are you guys? The opioids?
Is that what it is?
Girl will be asleep, so that's actually probably a good thing. How about the Indexinets?
The Indexinets, okay. All right.
What word is that?
2 reversal agents. So this is apparently reversal Jeopardy.
All right. Well, we'll go ahead. Oh, wait, what am I doing? Should I just stop? I think I stopped sharing. Yeah, share. Sorry. Okay, there we go. All right. So rules: don't cheat.
No using phones or anything like that. Put those away. No cheating. And then it's tough to kind of keep score, so we like to just go back and forth. So like one team will have a turn, the other team will have a turn. If that's okay with everybody, we won't steal questions. Okay.
All right. I think that's really it.
Yeah. So if you get it right, you get points. If you get it wrong, we're not going to subtract.
We won't take
points.
it.
It's just addition.
All right. So the first categories are: let's give them some groceries. So nutrition. Up a creek without a paddle. So this is pain, agitation, or pain, anxiety, and delirium. Think. This is neuro-related stuff. And then preventing the inevitable. So talking about prevention in ICU patients and prophylaxis. All right, and then bugs and drugs. All right.
Let's see how do we want to decide who goes first?
I'm thinking of a number, and you guys can both guess.
Number what? 1 through 10? Right?
Yeah, 1 through 10. Okay. What do you guys think? Okay.
3.
It was 3, so there you go.
You guys get to go first.
All right.
Yeah, there's 3.
Okay. What category would you guys like?
My job is done.
Now we're just going.
We're just gonna go back and forth. It's hard to yeah. Okay. Okay, this is the mechanism of action of heparin.
We get that.
Oh, I think you're a little lopsided. Just who's over there. He's right over there.
You're on the Indexinets.
All right. You guys have an answer?
The pharmacists are not playing.
Yeah, the pharmacists are playing.
Pharmacists? You have pharmacists?
We have 2 pharmacists.
All right. You guys have an answer?
Mechanism of action.
Mechanism of action for heparin. I mean, one of the pharmacists should be able to get this.
So.
No. It essentially binds the antithrombin to augment factors 2 and 10.
We'll give it to you. Yep.
Didn't Frank say more of a question?
So it does augment antithrombin and prevents factors 2 and 10. All right, your guys' turn.
So we're still trying to read the first one. We're trying to read that.
Oh, sorry. I don't know if I can.
They got it correct. Yeah, you got it correct. Sorry.
Okay, sorry.
So the mechanism of action of heparin, what did we need to learn from that?
It binds to antithrombin 3, which is one of the endogenous anticoagulants. Thus, it will then enhance the ability to block factor 2A and factor 10A. Sorry, had a brain fart there.
Yeah, you're good.
It's like my favorite thing ever. Yes,
Yes.
it must be in the presence of antithrombin 3. So it's an indirect mechanism of action.
So
So
if
what-
you have PTT, then sometimes you give that
Because you could have a relative or an absolute antithrombin 3 deficiency. And there's also the theory of relative antithrombin 3 deficiency in trauma patients might be why they have low anti-10A in the setting of an experience. It's your guys' turn. What's
Give them groceries.
Give them groceries? 500? Okay. All right, 100? Okay. All right, kilocalories per gram provided by amino acids.
this is 100.
How many significant figures do you need?
Just one. Correct.
You're the Narcan.
All right, your guys' turn.
All right, Adexanet.
And Dexanex, what would you like? Bugs and drugs for 300. Okay, antimicrobials implicated in the following EKG. You have to name 4. It doesn't have to be 4 classes, but 4 drugs. It has to 4 drugs that may result in the following EKG.
It's too hard to track.
Just individual drugs.
Levofloxacin, azithromycin, ciprofloxacin, and pentamidine.
Maybe another one for I don't know.
Oh, erythromycin.
Okay, we'll give it to you.
Oh, contaminated there.
There you go. There you go.
Good job. Contaminated there. You're right.
All right.
You win.
You win.
All right.
All right.
Narcan. I know. We've got a second round.
I don't think
There's a full second round.
Okay, bugs and drugs, 500. All right, besides vancomycin, name 4 out of possibly 8 antibiotics that cover MRSA.
And it does not count to name community patterns, so Bactrim, tetracycline, Clinda don't count.
Yeah,
I said Bactrim, Clinda, and tetracyclines don't count.
correct.
Because that's more community-acquired MRSA. This is real nosocomial MRSA, assuming it's resistant to dosing.
Ooh, hard one. I've heard 3.
Or 3.
Which ones did you get?
So, okay.
And then Abby guys there's
You have another one?
No.
You said linazolid, Dapto, and
They come up with one more.
ceftaroline.
And besides Vanco.
All right.
Okay.
No
All right,
points.
no points.
No points.
So the newer drugs like telavancin, ordovancin, and dalavancin, and then Sinercid and tigecycline. All right.
What are the sprays?
The 3 at the bottom are newer ones, kind of related to vancomycin, that have a very long half-life.
They were approved in skin and soft tissue infections, and usually it's a one-time dose, depending on which drug, followed by another dose, about 5 to 7 days later. So there's lots of new, and yeah, they're pretty cool. They're really expensive. Yeah.
There is some talk
but
about
they're all
yeah.
approved for skin and soft tissue infections. The problem is they're really expensive. So right now they're non-formulary, and there's a lot of expanding literature of maybe roles in some of our non-compliant patients, like people who we don't want to put a pickle in and send them home with it, or they have to go sit somewhere because of recreational habits at home. So hopefully more to come in that setting in the future. So if you ever need anybody, if you ever need a Rudavancin or Dalavancin, they do have patient assistance programs. So get ID involved sooner rather than later.
We We've done it in an outpatient setting, not inpatient. What's that?
Not a lot of data. These are all independent.
Yeah.
All right.
You guys. The indexinates.
Up the creek for 3.
Up a creek for 3. Okay. Advantages of dexmedetomidine over continuous infusion of midazolam is described in SEDCOM. So 2 out of 4 possibilities. Okay. I'll give it to you. That's 1.
Less mechanical ventilation days.
That is correct. We got 2. So decreased ventilator time, decreased delirium, and then less hypertension requiring treatment and tachycardia requiring treatment. All right.
The Narcan.
Narcans.
All right, 500.
500, going big. All right.
Oh,
Double Jeopardy. Oh.
So you guys only have 100 points, and is it Jeopardy rules? You can go up to 1,000, right?
1,000. Okay.
1,000.
All right. After how many days of held lamotrigine do you have to reinitiate to avoid SJS intense? Assuming a patient with normal renal liver function. So essentially, when do you have to retitrate after being held?
So remembering that lamotrigine has a black box warning against up titration because of the risk of cutaneous reactions, particularly SJS intense. So if we have somebody who comes in on this medication, depending on what they're on it for, and we hold it for a period of time, we can't just resume that normal high dose. We have to restart the titration and go up. So what's that time frame?
We're saying final
What
answer.
is it?
That's 5 days.
Should we give it to
Probably a
them?
little long.
It's a little long.
5 to 7.
How about, we'll give you half. We'll give you half.
We'll give you 500
Because technically, that is
Yeah.
a correct statement because you would have to reinitiate. It's just longer than
Yeah.
So
So 4 to 5 days.
We'll give you half.
Because if you're looking at the half-life in a patient with normal liver and renal function, it'd be about 1 day. So we'll give it to you.
All right.
Okay. You guys.
Indexinates.
Indexinates. All right. This medication is the only FDA-approved therapy for urgent reversal of acquired coagulation factor deficiency induced by vitamin K antagonists. So warfarin. So if you have someone on warfarin, this is the only FDA-approved agent. This used to be our Yeah. All right. What do you have an answer? I'll give you a couple more seconds here.
I would say
All right, there you go, K-Centra. All right, Narcans. Paddle for 500. All right, per the most recent guidelines, these 2 behavioral pain scales are encouraged to be used in patients unable to self-report pain or that have intact motor function. So essentially, in intubated patients,
Pain.
for pain,
For pain.
for pain, for an intubated patient.
Pain. For patients who can't tell you.
One baker.
Minus 500. Yes, that's right.
No, sorry. So behavioral pain score, the critical care observation tool. Our OPAS is kind of a made-up one that's similar to the CPOT. So
we need to.
All right, Narcan or indexinates.
Yes. She did these things.
What, 300? Oh, let them go through. Only 301 left. All right. First described in the monograph, a biometric study of basal metabolism in man in 1919. This equation is still used today to assist in estimating basal energy expenditure. All right.
I think I said it.
I think you said
we
it.
heard
Yeah,
you.
Harris-Benedict equation.
So really points.
So it's still a little bit flawed, but can give you some good baseline information.
Okay.
All right, Narcans.
Just to give a score update, just so we know where we are. Narcans, you have 600, and Dexinus have had a lot of 300s that have gone right. They have 1,500. So Narcans has some catching
All
up to
right,
do.
Narcans, what would you like?
Bugs and drugs for 400.
Bugs and drugs for 400. All right, level 3C evidence suggests combination therapy with vancomycin and metronidazole in this patient population. More specifically, we'll give it to you. Serious sedum. Initial
So it's fulminant, right?
fulminant. Yeah, so we have hypotension, shock, ileus. Yes. Real severe, yeah. All right. Dexinus. Bugs and drugs for 200. All right, common pathogens that are MDR and often found in healthcare settings, often with the acronym ESCAPE.
So we're looking for the bugs that are each of those levels.
Yeah, so what was the
Wait,
first one you said? Sorry.
Serratia.
Wait, can you start over?
Well, yeah, sorry. What was E?
Serratia, and E is equal.
No.
No,
And the S is also wrong. So Staphylococcus and Enterococcus. You got four.
Oh, that's true.
Well, good luck.
It's not with that.
Okay. Narcans.
Narcans.
What for 500?
Preventing
All right. Shown to be the preferred agents in certain populations, like trauma patients. Low molecular weight heparins employ this 10A to 2A inhibition ratio.
So we're looking for the range. So we know heparin is 1-to-1 for how much it inhibits 10A versus 2A and its mechanism. So for low molecular weight heparins, what's the range of 10A over 2A, knowing 10A is what it preferably goes for? Erica Krantz.
Erica?
Erica Krantz. We'll take a range.
We'll take a range.
0 to 1.
Yeah. Dr. Krantz.
What you got?
You can do it.
Say what your brain's telling you. I think I heard you say it. It is.
It is. You're right. All right. Nice job. Okay. Dexinus. What would you like? Groceries, 400. All right. 2 benefits shown of late TPN initiation. There are several.
6 possible, and we told you mortality is no.
What's that?
Don't say. Speaking as we're just.
Yeah. You should get a lot of voice.
Nothing?
No. It's down, right?
It's not nothing.
There's no negative points.
Yeah, there's not. Yeah, no points. 2 wrong answers. Okay, I'll give you that one.
I didn't know what it was.
Infections.
Like what's it? Okay.
Okay, you got 1 infections. What else?
It's like the
I think that is one. I think I heard 2 of them. So increased likelihood of ICU discharge alive, so less ICU days, less hospital days. You said ICU infections, and then less incidence of cholestasis, CRT, and healthcare costs, because TPNs are expensive. Okay. Narcans.
Narcans. Better catching up.
Think. How much? 400. Okay. All right, the Interact 2 trial authors suggest lowering blood pressure below this value after ICH may improve modified Rankin scale scores at 90 days.
The one demonstration, there was one, well, Interact 2 was, should I just run this?
I hate it when that happens. Put on
It's an systolic blood pressure goal. Yep.
Interact 2 is 140 versus 180.
Final answer?
It's below the 180 or 160.
140, 160, 180.
No, it's 140.
140. You said it.
Had it.
You had it. All right. Index and notes. Paddle for 400. Okay. All of these are symptoms of the answer we're looking for. Metabolic acidosis, arrhythmias, hepatomegaly, rhabdomyolysis, AKI, hyperkalemia, and cardiovascular collapse.
And your hint is this is something that's drug associated.
Yes. Drug associated in the.
What is Chris?
Yes. Yes, propofol related diffusion syndrome. All right, Narcans.
Groceries for 500.
Groceries for 500. All right, early enteral nutrition maintains gut integrity and modulates disease severity via these IgA producing cellular structures along the GI tract. Okay. Did you get it? I think that's fine. Okay, yeah. Malt and galt. Yeah.
Yeah, they said Myers patches, which are which is in that. Yeah.
Yeah.
That counts.
All right.
All right, narrowing the gap between the two. Narcans are at 2,000, and then Dexinus are at 2,500.
Oh, wait. Catch it up. All right. What would you guys like? And Dexinus. 400?
Yeah, sure.
Okay. Risk associated with short and long-term PPI use shown in the literature.
Name 3.
So CKD, osteoporosis, osteo.
What was the other one besides osteoporosis?
C. diff, AKI.
AKI, you have another one? I don't think I don't think that's on there.
So the ones that have been shown in literature are maybe some renal related things with hypocalcemia and hypomagnesemia, but that's more absorption related. So the C. diff is correct. The osteoporosis is correct.
Fault by
I don't know
hypoglycemia. CKD is not. Yeah.
So
Sorry.
Well, we can half the points.
All right.
Narcan.
Narcans. What do you want? Think 200. This medication is indicated for improvement of neurologic outcome by reducing incidence and severity of it. Okay. Nimodipine. Okay. All right.
Should get through these top ones pretty quick.
Paddle for 200. All right. This is what?
Yeah, I used to.
All right. Narcan. All right. 2 of the strongest independent risk factors for stress ulcer prophylaxis. Yep. Mechanical ventilation and coagulopathy are the answers. All right. Dexinus, last 200. All right, this ratio is called what? It's the close respiratory quotient. Yeah. All right. So this is what you do when you get a metabolic cart to assess nutrition status.
Narcan.
The appropriate loading dose of phosphonatrine. There you go. Yep, 15 to 20 mg per kg. All right, this class of beta-lactams do not cover enterococcus.
Tash.
Cephalosporins, except cephalosporin might cover some strains of E. capalis. All right.
Yeah. Which one?
What do you
Paddle
got?
or inevitable?
Okay, appropriate timing of broad spectrum antibiotics initiation in patients with. I'll give it to you. It's 45 minutes. Yeah.
New York State says less than an hour.
All right, last one.
Paddle.
Paddle. Okay, morphine metabolites accumulate in renal dysfunction.
Name the active metabolites.
What are they, Kelly and Julia?
And 3 and 6. If you're on it.
Yes. Morphine 6. Morphine 3, glucuronide, and morphine 6.
This is why in elderly patients and in patients with CKD, we talk about using morphine cautiously because of the active metabolites will accumulate. What? I'm sorry, I still can't.
He wants to know the counts right now.
Oh, yeah.
Okay.
All right, the gap is
Oh,
narrowing.
yeah, man. we're getting
Narcans
close.
are at 2,700 and indexinets are at 3,000. So 300 points between the two, just in time for double jeopardy. There's no
We
subtraction.
don't take
It's just
subtractions. Yeah.
It's all addition.
All right.
But there's still always final jeopardy.
Yeah. So the categories are pumps and hoses, fear of rejection, to bleed or not to bleed, where's your evidence, tox box, and that's it. I don't know why I thought there was.
All right, so the indexinets went first last time, so
you
the
guys-
Narcans get to go first this time.
Oh man, going big.
Oh! All right, so you guys, 2,700, okay.
Okay.
No, you
Did
don't.
you guys?
Sorry.
You made your
Yeah,
wager?
yeah.
Okay.
I got it.
All right. This agent works by inhibiting soluble guanylate synthase or cyclase. Sorry, reducing cyclic guanosine monophosphate activation of inducible and endothelial nitric oxide synthetase. I think I should stop reading the questions.
No stealing.
No stealing.
So this agent inhibits. Yes.
Yes.
Correct.
Yep.
Correct.
And inducible nitric oxide synthetase.
Synthase
Synthase.
enzyme.
Yeah. Sorry.
Inhibits soluble guanylate cyclase, reducing cyclic guanosine monophosphate activation of inducible and endothelial nitric oxide synthase enzymes in the category of pumps and hoses.
Is it a calculator?
All right, final answer?
Final answer?
Final answer?
And you guys want to
Oh, I
take
thought you
that?
guys, I thought it is
It is
methylene
methylene.
No, don't get me
No,
wrong.
we're just for funsies.
No,
No, no points.
but Julie, but you guys get the bragging rights for knowing the answer.
Yeah.
There you go.
All right. Indexinant. Yeah. Sorry.
No, that's okay. All right, and Dexinet, your question. Which one do you guys want?
Or to keep score.
Pumps. Unique property of milrinone by which it facilitates ventricular diastole and filling. It's a nice fancy word. Mr. Dr. Droege likes this word.
He does. Yes.
Like, are you just thinking like the process of that?
Yeah.
Oh, lucid trophy?
Yeah.
That is correct. Yes.
What do they mean?
All right. Narcan.
Narcan.
Oh, going big. All right.
Mechanism
Mechanism.
of action, TXA, tranexamic acid. Tell us how it works.
It is a,
What did you say, Curtis?
that's why we're the license.
What do you think?
No.
Give it to him?
I'm going to give it to him.
Okay. Yeah, we'll give it to you
We'll
guys.
give it to you because Curtis is one of our pharmacy students. The fact that he was able to at least give us plasminogen in conjunction with fibrinolysis prevention. There were words on all the right path.
Yeah.
So,
All the, so you guys had a lot of the right buzz phrases, but it's a competitive inhibition of plasminogen activator. It binds to where lysine normally would bind. It mimics that lysine binding site.
Is it the same as Anaphar?
Yeah.
yes.
Yep.
It just has much higher potency, so you give about the equivalent of 10 times less the dose to get the efficacy that you want with TXA when compared to aminobutyric acid.
All right, and Dexinets?
Your objection without.
Wow. I think this might be a hard one. All right, the following symptoms. All right. Because it has to do with sarcomas. Yeah.
You just said they picked it before you did.
Yeah, come on.
Rejection 2.
All right. These two calcineurin inhibitors are the backbone of maintenance immunosuppression for solid organ transplants. What are they? Yeah. Yep. Well,
I'll answer the question with it.
so
And then this
I had a heart transplant.
That's true.
No,
Yeah.
because
Yeah,
that
you're
is
right.
actually not a calcineurin.
Yeah,
Like
sorry.
the sport is. You're right.
Sorry.
Okay.
Yeah.
Details. Details.
All right.
Graham, you're on call tonight.
What do you by C get? Tox for AG, my
Tox for what?
Talks for 8.
What?
Oh, you found the other one.
Oh, yeah,
All right, so
yeah.
points review right now. Narcans are at 3,700 and Dexinets are at 4,800. They got a couple of thousands in there. Don't lose points.
Do we actually not lose points?
You don't lose points. Yeah,
Well, then,
I know. I should have thought that one through for a couple there.
I know.
Oh well.
But we haven't.
It's
done
always
it.
final.
All right. What?
What just happened?
What just happened?
It malfunctioned.
No, that is weird. I checked that. Well, okay, so that's a wash. But
Oh.
what it should have said was all these symptoms of digoxin
Let's
toxicity.
give
So,
you, pick a different one and we'll
Pick a
get to that
different
as
one,
double
yeah, and
jeopardy,
we'll-
that malfunction.
yeah. Which one would you like?
Similar, same number.
yeah, I'm gonna be picking 200.
No, yeah, similar
It has to be an
800, or if
800
you want,
one.
or if you want 1,000 in Tox Box, we'll give you that one since it was in Tox
Yeah.
Box.
Rejection rate.
All right, rejection for 8. These are potential options for PCP prophylaxis in patients with a severe sulfa allergy.
And you have to name
You need 2.
Contaminated dapsone, glutathione, is treatment.
Yeah, you got them. Yeah, dapsone, pentamidine, but aerosolized amitriptyline. Okay. Narcan.
I know, mad it up.
Yeah, you guys got it. Tox for 1,000. Okay. This is the mechanism of action of hyperinsulinemia euglycemia therapy for calcium channel blocker and beta blocker overdoses.
There's, it increases, thank you. It's the thing.
You're not wrong answer. It's not
Good
wrong.
answer.
Sorry, I can't
Slice
get
minutes in.
Is it?
Yeah.
Also myocardial output.
It does. What do you say to carry on? Whatever. Yeah. Okay. It sounds reasonable. So you can. So you were kind of. So by activating ATP, you do increase intracellular calcium through secondary mechanisms. Also just helps the utilization of glucose in the myocardium, which is thought to increase cardiac output, and it has other anti-inflammatory effects. So, but what Carrie was getting at is that it does increase intracellular calcium through ATP.
All right.
Yeah. All right. And Dexamethasone.
So score, just to make everybody feel, 4,700 for the Narcans, 9,600 for the Dexamethasone because of that double jeopardy. So.
Let's do bleed for 8.
Bleed for 8. All right, these 4 factors are included in the 4T pretest probability score for the identification of patients with HIT.
And you have to name all 4
Yes.
of the 4 T's. We're not asking for the features, just name
Just the 4
T's.
things in it.
Yeah.
Decrease.
The actual 14.
The actual
What
4
are
T's.
the actual 4 T's?
Yeah.
Timing, thrombocytopenia. Other.
Other than the P, the other.
Thrombosis.
Yep. So thrombocytopenia, timing, if they have active thrombosis, and then if they have other causes.
And just as a reminder, if you have somebody who you are concerned that may have HIT, this scoring system and a wonderful guideline around the risk factors is available on the intranet on the formulary website. If you go to the formulary website and type argatroban, it links you to the institution's 4T scoring system with all this including and treatment algorithm based on what you believe your patient's risk is and whether they do or don't have thrombosis. So I highly recommend that if you have difficulty remembering this because it provides really good guidance around what to do, and it also helps understand when does an SRA get sent versus when does it not, depending on the pretest probability that you are inputting into the system and what the ELISA comes back at.
All right. So the Narcans?
Oh, yeah.
Okay.
Where's your evidence?
4,000? Okay. Hailing from Leuven, Belgium, this intensivist served as primary and senior author on many papers having to do with tight glucose control that shaped practice prior to publication of night sugar. So what is the author on all of the intensive
that person?
glucose papers?
His or hers.
Yes, it could be a her. Starts with a.
It's a her.
It's a her. Starts with a.
All right, time's up.
Greet
Dr.
Vandenberg.
Vandenberg.
All right.
Great Vandenberg.
Let's not do evidence.
That was 1,000 points.
That was a hard one. Okay. Inotropic agent of choice to increase heart rate if vagus nerve innervation has been interrupted.
I let's go with my promises.
I'm nervous. I think it's isotonic.
You're correct. Dobutamine epi and dopamine can also be used, but don't have a strong data. Okay. Narcans. Toxbox for 6. All right. When overdosed upon, this class of drugs mimics class 1A antiarrhythmic medications, resulting in widened QRS and prolonged QTCs. Correct. TCAs. And Dexamethasone.
Rejection.
Rejection for 6. All right, this medication can be used for induction immunosuppression. It should be administered over at least 6 hours and requires pre-medication with corticosteroids, acetaminophen, and/or antihistamines to reduce infusion-related reactions.
Oh, I know.
Correct.
Rabbit juice. That is an objection.
Yeah. Bleed for 6. All right. Okay, this is a very long question. But essentially, you have a patient that comes into the ED that has a head bleed, is going to the OR with neurosurgery. She is on apixaban for AFib. She took it this morning, according to the family, and the anti-10A is elevated at greater than 1.8. So you're given a dexamethasone. We need to know the dose. Decisions made.
Whatever my pharmacist says.
So there's low and high dose.
It's low, but I'm trying to think of the dose. I think it's 9
It's actually high, right?
But you have to, but that's the, I'm trying to think that's loading dose.
Why is it? Wait, it's high. Why is it?
Because it's 2.5 milligrams BID, so it should be the low dose.
Okay.
But
Low dose.
It is, okay, you got it. All right, it is low dose, so we'll give it to you. Specifically, the low dose is 400 milligram bolus, infused over 30 milligrams per minute, and then you follow it by an infusion of 4 milligrams per minute up to 120 minutes. So since it is the low dose, like Erica was saying, the 2.5 milligrams, that's why she automatically qualifies for the lower dose. So, yeah. So if the azapixaban dose of 5 milligrams, greater than 5 milligrams, then we do a high dose. If it was less than 8 hours, regardless of whatever medication is, if it's over 8 hours since the last dose, you do low dose. Yeah. All right. And dexamethasone.
I'm sure for it. No.
Everyone's scared of the evidence.
I know, that was the question. Scared you guys. 400, is that what you guys wanted? Thompson has this? All right, proposed ratio of alpha and beta adrenergic receptor pharmacology for norepinephrine. So looking for percentages of alpha and beta.
I say those two girls should know this.
Yeah, I was going to say, you
These
two,
girls should know this.
yeah, you two should know that for sure.
90-10, some people say 80-20.
Correct.
See, you know it.
Yeah. Perfect. Right. And both answers right there. Okay. All right. Narcans. Tox for 400. All right. This is the antidote for ethylene glycol and methanol toxicities. Methazole. Yep.
Yeah, where's
All right.
rejection?
I love that.
All right. Many immunosuppressive regimens will contain this class of medications, which can cause hyperglycemia. Often, that's worse in the afternoon. Yeah. Corticosteroids.
All right, clearly that group's too easy.
Yeah, I was gonna say. So, noted we need to make fear of rejection harder. Okay. Which one? Bleed for 400? Okay. This is the cutoff for the platelet activity for ADP receptor antagonists on the Verify Now
This is a
assay.
surgery thing.
For ADP.
Yeah.
For ADP receptor antagonists, that's
Yeah.
There's 220, 240. It's like 500. Yeah.
So what's your answer?
That's it.
240.
It's close. Yeah.
Close.
It's
208.
208.
It's 208. I know, you guys did good. The aspirin's 500.
Yeah.
It's 550, but yeah.
Yeah.
All right. We'll do evidence.
Which one?
8.
Okay. All right. Catching some of the glucose control spotlight prior to nice sugar. This trial showed no difference in mortality between conventional and intensive ICU blood glucose control. The name of the trial. We're heavy on the glucose questions. We have to change. I don't know.
It wasn't her sexual stuff, it was just
Did you say it was in the second shot? Nice sugar
It's
too.
not nice sugar. Yeah, prior to nice sugar.
Prior to nice sugar.
Yes.
Yes, no guess?
Have an answer? No, yes?
No, I forget.
Okay. So it's the VICEP trial.
No, we didn't know that. Okay.
All right. Narcans? Evidence? All right.
It's confident.
Okay, this study showed no difference between dopamine and norepinephrine and 28-day mortality in the treatment of shock. It changed, well, it's actually the surviving sepsis, whatever. But yeah, the one that just came out.
Anyway, the name of the study that showed no difference in mortality
Between dopamine and norepi. So kind of made dopamine go out of favor?
No.
Erica?
I don't know the name of the study.
Yes, you do.
I'm wrong.
Yeah.
Okay. All right. Do you guys know? Step 2. Remember
Step
step 2? Yeah.
All right, indexinates.
Let's just end this misery.
The evidence for 400.
All right, these are 2 images from a trial that we're looking for. So we're
Yeah.
so looking at the SAFE trial, compared albumin to saline, resuscitation in ICU patients, overall no difference.
Every single.
All right, Narcan. Okay. All right, iduruzumab.
Iduruzumab
There
could
you
be
go.
efficacious for an overdose of this target-specific oral anticoagulant. So what does it protect?
Pradaxa, yep. Dabigatran. All right, this inotropic agent should have renal dosage estimates. What's that?
No.
Going in, yep. So you would start about half the dose at 0.25.
All right.
Narcan?
2 Narcan.
Which one do you want? Bleed? All right, this is the blood pressure limit for TPA, for administering it. Yeah, 185 over 110. All right, last one, indexinates. All right, this study showed decreased norepinephrine with the addition of a low-dose vasopressin in septic shock. So, VAS trial. All right, so now,
So the score recap going into a final Jeopardy. The Narcans are at 6,700, and the indexinates boosted by their double Jeopardy are at 12,000. So consult with your group about your wager.
We actually lose points.
This one you
we're
can
gonna
actually lose points.
yeah.
So what are they?
So the topic for the question is adverse events in literature.
Yeah, and
So
the
talk
score
amongst
is
your group. We're not as with 12,900. So as with Jeopardy, we will not reveal your wagers. We will come around and get your wagers so you can keep it secret. 67, 12,900. 67.
Here, write your wagers.
All of it.
Keep it a secret.
They're all, yeah.
Because they didn't double up the 13.
502. 502. All right. Everybody ready?
You guys ready?
Okay, as with for Final Jeopardy, there is a timer.
Okay.
Okay, so no cheating. No cheating. Okay? Adverse events in literature. Are we ready?
Okay, everybody ready?
Since this is very much a buzz topic with everyone knowing and learning about Indexinet, we want to know the reported rate of thromboembolic events in the Anexa 4 study. You gotta get it.
Yep.
They reported
right.
one number.
Time starting.
This was the percent. The percent. Just talk amongst your group and we'll ask your opinion. The percent. What was the percent of thromboembolic events? Look at theirs.
That's good idea.
They wagered without you, Julia.
Good.
Yeah.
All right, time's up.
All right, the answer is.
All right.
So you guys both got it
Yeah.
right.
Is it like completely tied?
I'm just really proud of Jeff Mike's contribution. When there's a gold letter, it needs to be
Oh, is that
So the big teaching point here that we wanted to emphasize is it was reported as 18%. So when you compare this to the PCC's literature, this is higher. And for those of you who were at Dr. Keegan's lecture a month ago, maybe, he talked about some of the newer literature. So as a reminder, some of the newer unpublished literature that Portola has brought forth as some of their additional to the interim analysis that was published in New England, the event rate is coming down closer to what it was with PCCs, probably around 11% when we look at the 30-day mark for those thromboembolic events.
just a bigger sample size? Yeah.
Yeah, bigger.
Yeah.
More denominators get bigger, more utilizations, so they're coming out.
I know.
You know
Yeah.
what I mean? Like,
Yeah.
there's obviously some,
Yeah.
you would assume there's some sort of underlying
Yeah.
condition that
Yeah.
would be
And
more interesting to know what is that.
Right.
but that's a lot of the theory is a lot of these patients are having these events due to just stopping the drug that was preventing them from before. So it's their underlying condition, obviously, that's resulting in these events.
Yeah,
So,
because if you look at the event rate, once you start back anticoagulation, it's much lower, obviously. So.
all right. So the winners are the Andexanettes. You guys have to write.
It wasn't that. I mean, it was pretty close.
It was close.
Towards the end, yeah.
Yeah, we only made you 5
Yeah.
We just wanted to make sure that we each by one.
Yeah.
Well, no, that's no.
Oh,
It's
I'm
not
sorry.
like that, yeah. I think it was 2 points.
Yeah, you guys won by 2 points.
Yeah.